With the sudden blow to the head, a traumatic brain injury has occurred. But nobody knows, because unlike a broken arm or a broken leg, a brain injury is not something you can see with the human eye. According to Dr. Paul McCrory from the Clinical Journal of Sports Medicine, traumatic brain injuries account for one-third of injury-related deaths in the United States. Every year, 275,000 people are hospitalized because of a traumatic brain injury. Now, think that's enough? One in every five people hospitalized will die in that same hospital visit. Now, due to the decreased prevalence of concussions, the general public is definitely more educated. But I don't think that's enough. A concussion occurs when there is a sudden shake or blow to the head or body. Surrounding the brain is called cerebral spinal fluid, which cushions the brain and the skull. Now, a concussion will be sustained when the head is hit hard enough for the brain, as the tennis ball is shown, to crash into the skull, like such. This causes soft tissue damage, or a bruise. There are two types of concussions, simple and complex. Dr. Heegert of the Emergency Medical Clinics of North America explains that a simple concussion is when a patient's symptoms generally subside within 7 to 10 days. Some of these simple symptoms include amnesia, confusion, sensitivity to light and sound, as well as fatigue. Now, as the concussion persists, it will then be classified as a complex concussion, or one that lasts a little bit longer and affects you a little bit more. In addition, patients with multiple simple concussions would also fall into the complex category. Because a concussion is a brain injury as well as a brain bruise, a bruise is repeatedly worsened anywhere else in the body, so it will take longer to heal, just like it would in your brain. Separate from these two types of concussions is a potentially fatal condition known as second impact syndrome. Second impact syndrome occurs when a second concussion occurs before the previous concussion has completely and thoroughly healed. Though rare, these symptoms lead to rapid swelling of the brain, which requires life-saving emergency surgery in order to reduce the swelling. When the impact occurs, the brain may swell to such an extreme that the cerebrum is pushed through the small holes within the skull. Dr. Weetjen explains this process known as herniation. A large proportion of those who suffer from the syndrome do not survive, and the few that are lucky enough to generally have mental disability for the rest of their life. Luckily, due to precautions taken by athletic sports teams, there really haven't been any major cases in professional sports of second impact syndrome. Now, concussions affect every patient differently. There are many complex and atypical symptoms. Some of them can include mental fogginess, headache, dizziness, nausea, irritability, and even impaired vision. But there are no outward signs of concussion, so Dr. Randolph Evans suggests one would look for poor concentration, emotional moodiness, slurred speech, personality changes, difficulty following simple directions, such as spelling simple words, or just being slow to answer questions, almost as if the patient is inebriated. Because a concussion is an internal injury that cannot be observed, as said before, the diagnosis is challenging. In order to effectively diagnose the injury, the patient should be asked questions to test their ability to pay attention, as well as their learning and memory skills, according to Dr. Halstead. Some of these questions can include simple math problems as well as mental puzzles. Now, in some cases, imaging testing such as CT scans or MRI may be prescribed to make sure that there is no damage to the spinal cord and there's no spinal leakage as well. Now, this all sounds pretty bad, doesn't it? How can I avoid this? Well, here's some bad news. You can't. The only way to completely avoid a traumatic injury to your brain is to not compete or really live at all. Sometimes concussions are inevitable and avoidable. There is no way to completely eradicate concussions as a whole. No matter if the athlete is swimming, walking, or playing a contact sport, there is a chance an injury can occur. With the possibility of contusions, athletes and parents must assume the risk they are taking by competing. The only option an individual truly has is to not compete in order to reduce the risk. Traumatic brain injuries are frequent in today's active society. The problem is, because it's an internal injury, Numerous brain injuries are either not diagnosed or not treated properly. As a result, minor brain injuries can turn into major problems. If treated properly, though, these cases can become a predicament of the past. As knowledge is spread, the number of these cases can be lowered into becoming a minor problem. The number of blows to the head will stay the same, and so will brain injuries themselves. But knowledge of the situation, that can save lives.